Hello and welcome. My name is Amita Vadva. You're watching the Bajaj Allianz General Insurance presents Times Network Living Room Conclave India Health Mission series co-powered by Herbalife. India Health Mission, which is an initiative aimed at informing, educating and ultimately empowering citizens around safeguarding our most valuable yet often overlooked asset, which is our health. Now, our series wherein we do a deep dive with industry movers and shakers from across the country's healthcare ecosystem on the road that lies ahead towards building and becoming a healthier India. And as we look to the long-term roadmap towards becoming a healthier nation, what are the metrics that will matter the most? What are the measurable benchmarks that will define our progress as a nation? How might the world score India on a health-specific report card? To tackle this very topic, we are in conversation with a highly distinguished panel of subject matter experts. Please allow me to introduce our guest joining us. We have Mr. Tapan Singh Gill, who is the MD and CEO, Bajaj Allianz, a General Insurance and Chairman, General Insurance Council, Prashant Tandon, co-founder and CEO, 1MG Technologies Private Limited, Sunil Kumar Sinha, Senior Director, Public Finance and Principal Economist at India Ratings, and Dr. Ishik Khosla, Clinical Nutritionist, Center for Dietary Counseling. Dr. Khosla, welcome. Thank you very much for taking out your time. What is exactly the significance of preserving the general well-being of young India, ma'am, especially when we talk about how they play a major role when it comes to the country's future economic growth?
Well, it is a very important demographic group, and we all understand that they will be the future of the workforce, they will be the future leaders, and they are the most powerful catalyst for change for anything. There is a huge economic crisis which we can expect if we don't invest in the right approaches and strategies for preventing ill health. And we do know that there are so many people today getting preventive health checkups. There is so much information out there. People, I would say, the youth also is far more enlightened than ever before on issues of health and nutrition. And so much has happened in the last 2-3 decades on this front. However, the crisis situation it has assumed makes us take a relook at what we are doing and how we are approaching health, and if we are really focusing on nutrition literacy or whether it's the right approach, the right way of dealing with it. I think it's time to sort of review our strategies and focus more on food-based literacy and focus more on the fact that we need to change the ecosystem with respect to food and make better food available to the youth. And just don't bombard them with information, because there has been information, I would say an infodemic, which has come up. And so make the youth more responsible themselves also by engaging the youth in food-based practices, in the cultivation of food, in the production of food, and in their menu choices, because they, like I said, they are a huge force to reckon with when it comes to change.
Right. So there's always scope for improvement there. Mr. Singh Gill, sir, reasons for optimism that also include the fact that population growth is stabilizing. Family planning is also taking center stage. Likewise, we are looking at dramatically improved healthcare infra and increased pan-India penetration of healthcare insurance as well, sir. So what are the causes for these concerns?
See, if you look at it, even today, close to 40 to 50 crore Indians are uninsured. Now, why do I put so much emphasis on insurance? First, a basic insurance cover. No, we can talk of add-ons later. It's simply because, to me, if you're insured, it's a question of or uninsured is a question of life and death. It's a question of dignity. Let me explain. If you have a good insurance cover and you feel ill, at the first instance, you would go to the best hospital, look for the best doctor. You're not worried about the cost. No. If you don't have one, you try to postpone going to a hospital or to see a good doctor. Maybe you go to a chemist and take some medicine and start from there. And then things go out of control, and it can be a question of life and death later. Second, if you have a good insurance, it's also a question of dignity. You're not depending on anybody else to help you out. In India, about 7% of India's population goes below poverty line because they can't afford the health expenses when somebody falls ill. And that is what you're talking about in numbers. It's about 10 crore people going below poverty line every year. It's a phenomenal number. Nearly all insurance policies also give you reimbursement for, I think, about 3 or 4 years of policy running of annual health checkups, no? So you can go get a checkup done, see if something is going wrong. Some insurance policies also have an OPD cover, no? So that takes care when you go to see a doctor and take care of it. Because you will be, like everybody knows that if you are able to detect something early, you're able to take care and before it becomes really bad, and you're still being able to maintain your health and take care of it.
By the time it is in control, in our time as well. But Mr. Sunil, to what extent is India's economic growth and its fiscal health that is now tied to the physical health of its citizens? Help us better understand how the two of them are interconnected.
Well, there is an old saying that health is wealth. Just extending this, you can very well understand that if the citizens are healthy, then they can contribute productively to the overall economic activities, and the summation of this economic activity is what gets reflected in the economic growth. And if economic growth is there, which simply means that the economy is growing, that simply means that the tax collections of the government is also growing. So in other words, all these three things are interlinked with each other. If you do not have a healthy citizen, then naturally your overall economic activity will get impacted. People will take leave. Most of the healthy people who should have been working, if they are ill, sick, they will not be able to contribute. So the economic activity will suffer, so economic growth will suffer, and if economic growth suffers, then obviously the tax collection, or in other words the fiscal health of the government also suffers. So these are all interlinked, and that is why it is extremely important to have healthy citizens. So that is why it is said that before a country becomes wealthy, it has to become healthy.
Right. Mr. Tandon, while we are broadly understanding the importance of becoming a healthier nation, what are the tangible metrics and parameters we need to take a closer look at to periodically reassess our progress?
In healthcare, mostly the metrics that we all look at, very, very important metrics, are actually metrics around mortality and death. But I think the time has come for us to start looking one step further, one step deeper, because health is not just about not dying, it's about living well. So while I think the core metrics that the government does track across the world, infant mortality, maternal mortality, average age of the population, all of that is extremely important and very, very positive. The other metrics that need to start coming in are the well-being metrics, the productivity metrics, how well are our people living, how healthy are they actually as they deal with the diseases or the various environmental impact that they face on a daily basis these days. So I think as a society and as an economy, what we really need to have is a good sense of these are the metrics that define a well-functioning, healthy society. So when we look at that, there are certain things that are fairly straightforward. Of course, we've been tracking the infectious diseases versus the chronic diseases or the NCDs, and that's a very healthy trend to at least have much lower infectious diseases. But going ahead, the big challenge in front of us very, very clearly is the chronic disease burden that the country is facing today. And when we look at the chronic disease burden, it's actually about 3 or 4 very critical things that we have to monitor and track very, very closely. Now, for example, if it's diabetes, it's how well you manage diabetes so that complications don't occur. So life cycle management of chronic diseases like diabetes. In cancer, very different scenario, but very, very, very big burden coming our way. It's all about early detection.
Right. Mr. Sunil, what do you believe are the leading development indicators that deserve immediate attention, especially for India, for example, which has the highest medical inflation rate across Asia at 14%? So what do you believe should be when it comes to the measures that need to be taken?
Well, there are a number of indicators, as I said earlier also, that one of the things that needs to be very carefully monitored is infant mortality, which simply means that how many births per thousand of population becomes mortal after the birth. Similarly, the nutrition of the childbearing mother is an important issue. Similarly, even after the birth takes place, then it is important that both the child and the mother are fed properly. So, the nutrition becomes important, because malnourished child will not become a healthy citizen, and in turn will be more of a liability than an asset for the country. Then apart from that, obviously the life expectancy is an important issue. So, and then there are various other measures in terms of how you measure say the number of cancer patient per thousand or per lakh population, and both communicable, non-communicable diseases, how they are emerging over a period of time. The other indicators that needs to be looked at is that how many doctors do we have per lakh population, how many hospital beds do we have per lakh population.
All right, our conversation around building a healthier India with a highly distinguished panel of domain experts continues on the other side of a very short break. Do not go anywhere. Welcome back to Bajaj Allianz General Insurance presents Times Network Living Room Conclave India Health Mission Series, co-powered by Herbalife. Now, we are in conversation with a highly distinguished panel of industry heavyweights as they share their take on building a healthier India. So, Dr. Khosla, ma'am, when it comes to the country's biggest health crisis today, that appears to be non-communicable diseases. There is why a concern that is raised as India being the heart capital or heart disease capital of India, diabetes that has crossed 100 million. There are several of them in millions that are said to be at a pre-diabetic stage as well. Several of them also suffer from high blood pressure. Likewise, as I said, we are the heart disease capital of the world, and the list goes on. How do you respond to that?
Well, it's a serious concern. And it's not only data that speaks. Today, I think individually we see people, hear of people who are falling prey to these heart attacks, youngsters just not waking up. I mean, literally every other day you're seeing a celebrity name in the same category. So it's big time, it's serious. And it certainly is a wake-up call. India actually has a twin burden. It's actually a triple burden. We have the non-communicable diseases, like you said. We also have micronutrient deficiency diseases. And so both the spectrums of hidden hunger, as we call it, seeing young, kids getting adult diseases, which was unheard of. Very scary. And both type 1 and type 2 diabetes, both are increasing. Autoimmune problems, children born with thyroid disorders, born with arthritis, born with these kind of conditions, which was unheard of. Autism. Just 20 years ago, it was 1 in 10,000, and today it's 1 in 59, and it's supposed to be going down even more. Inflammation is the starting point of all the diseases we've spoken about, and also the gut is a seat for nutrition. Malabsorption is one of the key issues today because we have surplus and we are not being able to make the most of our food. We have, severe micronutrient deficiencies in the form of B12. About 40–50% of the population is B12 deficient. Vitamin D deficiency is rampant, more than 90%.
I have a dozen more questions in my head to ask you, ma'am, later. But of course, Mr. Sunil, when it comes to the economic burden of non-communicable diseases, as Dr. Khosla was also pointing out, that is expected to exceed 500 lakh crores by 2030. Now, to believe that the healthcare ecosystem must clearly shift its focus from curative to preventive care, this becomes all the more critical given that the doctor-patient ratio also in this country stands at 1:1500. That is also a big concern, sir. What do you think is the possible solution?
Well, there are no easy solutions. I mean, because creating doctors is also an expensive affair, and as we all know, that the number of medical colleges that we have and the kind of competition the students have to undergo to obtain a seat in these medical college. I mean, now that of course there are a number of private medical colleges, but still the number of medical colleges, including the private ones, are not enough to produce firstly the number of doctors, and secondly the quality of doctors, which can really make a difference to the overall health scenario in this country. So no easy way out, but I guess one of the important thing that has been emphasized time and again is that what percentage of GDP are we spending on our overall health care. So in case of India, it is 3.8% of GDP is spent on health care. Because the health infrastructure, particularly the government health infrastructure, is not up to the mark, that is why the out of pocket expenses of Indian citizen is very, very high. Net net, the point that I am making is that as India is prospering, obviously we have come a long way since our independence in terms of per capita income, health, education, etc., etc. But health still has not got its due in terms of the spending as a percentage of GDP. So that needs to be looked into.
Right. Mr. Singhel, when it comes to wellness, do you believe that the insurers are incentivizing when it comes to the people who take care of their health?
Yes, they do so, because if you look at the premiums would vary in terms of how you take care of it. We took out wearable devices in which you can measure the improvement in your fitness level, and that has a bearing on the premium. Also, if, as I mentioned earlier, in about 3 to 4 years time, you get a free health checkup, which you can get done and see how things are moving for yourself. You also have a lot of groups which get created in terms of how do you collectively take care of your health. So it has a direct bearing, because I think if I look at, and I jokingly tell people that when you insure, you not only pay premium for things which go wrong, you also get 10,000 prayers praying for your well-being. I think insurers are the one who always would worry about your well-being more than anybody else. And that is why most of our products would be designed in a way that your well-being would be rewarded in terms of how you take care of yourself.
Well, that's important there, of course, wishes and also healthcare together. But Prashant, do you believe as we embrace the roadmap towards becoming a healthier India, what is that single most critical call to action that you would like to convey both to the authorities and also to the public at large?
So I think healthcare is moving towards a model of creating personalized healthcare, life cycle healthcare, and long-term management of wellness, so that curative interventions go to a minimum. Now, to move towards this kind of an aspiration of a model, a very, very important thing that is happening is, while medical professionals form the core of healthcare, a lot of new sectors and new disciplines have to become an integral part of the healthcare delivery system. Technology, data sciences, new age medical devices, they are fundamentally changing how healthcare works for a consumer, and also the economic model for the society. What's the right model? So healthcare, while it is at the core of it is a medical profession driven or powered sector, it does need and has a very, very strong application of technology interventions, data science models that are going to change the game here, and also financing models that completely change the way incentives get aligned over a life cycle of a consumer. We all have to have a very deep sense of the medical expertise, a very deep sense of technology expertise, and a very deep sense of finance. And all of these coming in conjunction, coming together, that's what will create the model of healthcare that I believe the world is heading towards. And while we do it, we don't do it just for our country, we actually do it as a model that will serve pretty much the global south, if not the entire world. So that's what the opportunity as well as the obligation is ahead of us.
Right. Mr. Singhel, how can we actually change the tonality when it comes to health messaging, sir? Right, from fear-mongering and information overload to, like what Dr. Khosla also pointing out, to inspiring in nature instead, sir?
Most of the time when you look at insurance, the way it has been sold over generations, I think there's a mistake in that. I think the insurers normally would say that this would go wrong with you, why don't you buy insurance? I think that's fine, that's a fact, but people normally get pushed back when the moment they think, and they would think, no, nothing will go wrong with me, which they should think. I think that's a very positive way to think at things, but things do go wrong. But if you look at it, what does actually insurance do? When you go back into society, in early into civilization, you had a group of people staying together. What were they trying to do? They were trying to insure themselves against anything which go wrong. No? If you look at animals also, they move in herd. What do? They're insuring themselves against if something goes wrong.
They have the back.
Yeah, that is it. That is the principle of insurance. No? And if you move forward a bit in civilization, you have villages. And if you look at villages, if somebody fell ill or something went wrong with somebody, the whole village would come together. Fast forward more closer to our times, you had joint families. No? In the joint family, something went wrong with somebody, and the entire family would come together. Fast forward today, you have nuclear families. Now, this whole big pool of resources helping someone where things go wrong now has completely shrunk to a nuclear family. So it's no more a big pool. Now, insurance is that large village. No? When you are paying a premium in that large village, something is going wrong with someone. And that money is being utilized to help that person come back and recover from things which is going wrong. When you think of it like that you are part of a larger community and you're contributing towards that, then I think the perception changes, because then fundamentally you look at human beings, they want to do good. I have not met any single person, and I meet like millions of people in my career, who I would think doesn't want to do good. No? And insurance is in a way in which you contribute to somebody else's
security, which one falls
yes, it helps anybody, and it's your money which is being utilized for somebody else's benefit. Things go wrong. A lot of people travel abroad currently, and let's say if you're in a foreign country and something goes wrong with you, you don't have friends there, you don't have family there. Whom do you connect? If you're insured, if you call up an insurance company, they actually help you right from emergency cash to getting you outside the country, helping you with the passport. They really take the role of the family which is there. So when you look at it from that perspective, then paying a premium is a good thing to do. God forbid something happens to you, but it's actually being utilized for somebody else's benefit. So, and the statistics and the point and the percentage points in which something may go wrong with you, and how do you plug that together? I think from that perspective, I would say being insured is very critical.
Steps that are taken today would actually probably during the end of the lifetime will greatly benefit each and every individual there, so to speak. But with that, this is the episode of Bajaj Allianz General Insurance presents Times Network Living Room Conclave India Health Mission series co-powered by Herbalife that comes to an end. We trust that you found the inside share of value. Thank you very much for tuning in.